Good morning, everybody. I hope you can hear me okay, Frangie.
We can, go ahead.
Perfect. Well, good morning. I hope everybody is well today. I want to just start by, first of all, acknowledging the 1-year anniversary of Mr. George Floyd's death yesterday. And I think that underscores the continuation of the importance of equity and fighting racism, and certainly taking on all forms of violence and injustice in our country. We want to just acknowledge the fact that there is a lot more work to do, but public health remains at the center of being able to work in this world of both fighting injustice, but also making sure that we bring violence and racism as public health issues to the forefront of the work that we do. I also wanted to just acknowledge the fact that we have a couple of guests on today, and I'm going to keep my comments quite brief today, as I want to have time both to talk about or have our team talk about myocarditis and pericarditis. We know that there may be a few questions related to that and vaccines, and also to make sure that there's time for our guests to be able to provide their comments as well. Well, let me start with first some positive news. I wanted to recognize the new state budget, which, as you all have been watching, has included close to $150 million, $147 million to be exact, for public health in the 21-23 biennium, and $296 million in the future biennium. I want to thank the legislature, and I want to thank Governor Inslee for this forward-looking approach to funding critical services and activities in public health throughout this crisis, but also well beyond this crisis. We know that these investments have been needed for a long time, and we know that the challenge of COVID-19, as we start to see light at the end of the tunnel, that's getting closer, and the light is getting brighter, that we have also uncovered many challenges and many gaps within the public health and health system as a whole. And we want to make sure that we do everything we can to fill those gaps. And I want to thank again the governor and the legislature and our leaders for everything they've been doing to really make sure that we are not using COVID-19 as a one and done moment, but really a transformational moment for health. The funds that have been set aside have been really can be used for a number of things, including investments in modernizing data management systems, modernizing and investing in our workforce, and really the know-how for the systems to be able to talk across systems and with each other. Other areas that are of benefit are obviously disease control, especially communicable disease control, environmental public health, maternal child health, chronic disease prevention, injury prevention, and certainly access to care. We've noted in COVID-19 and the response to this pandemic that many of these very areas have also been impacted, including in behavioral health. And we really want to make sure that these improvements are, again, not a one and done for COVID-19, but really what does health look like for the future. These improvements, we believe, will positively impact almost every individual living in the state of Washington for years to come. And so these are big deals. This is not just a small consideration. These have significant impact for the future for us. I also want, in the same vein, to acknowledge yesterday that at Department of Health, I made a series of organizational announcements with some moves towards shoring up our policy work, our engagement work, our work with strategic partners, and certainly our work on innovation by creating a new Office of Innovation that is going to really lead Department of Health into the future and really allow us to position our department as a leader, as an agency leader across the country. So I just really want to acknowledge the importance of that, and I've made a number of announcements in terms of those who are going to be filling those positions. I think it's an incredible recognition of the work that we have. We have Elizabeth Perez, who is our communications director, and Communications and Equity Director, David Bain, Director of Strategic Partnerships, Kristen Peterson, our new policy director, and we're bringing on Mr. Les Becker as our new innovation director. And so I really want to acknowledge just the work that our department continues to do, but also the incredible work that's necessary for us to be successful as we not just think about COVID-19, but also think well beyond it. So speaking of COVID-19, it's important to share some additional milestones. And if I could have Frangie, if you could just pull up some slides and I'll go through these. I think first and foremost, we want to just recognize that we have now reached 2.1 million WA Notify users. And it's just an incredible testament to, again, the innovation and technology for fighting a pandemic that has been really critical to the work that we do. And I'll wait for the slides to come up, and here they are. And as you can see that we have made incredible progress also with vaccines. More than 3.1 million people in Washington are fully vaccinated. And I don't think any of us could have thought months ago when we started this process where we would be, but here we are, that we are starting to really see the blunting of the impact of COVID-19 by the use of vaccines and the incorporation of vaccines into our arsenal. So more than 3.1 million people are fully vaccinated. If we can keep going through these slides. In addition, more than 60% of our population has received above 16 years of age above have received at least one dose, and that represents 3.7 million people. And if you can just think about the incredible progress that has meant with all of our partners on the ground, everything that everybody has been doing, so that we are really truly saying #InItTogether. Next slide. And most recently, as of May 22nd, we have almost 77,000 adolescents who have received one dose as well. And Washington has been one of the leaders across the country when it comes to adolescents getting vaccinated, with really our community members and particularly our parents taking heed for the notice of protecting their young ones and their children, their adolescents, to make sure that they can also be protected against this pandemic. Next slide. You know, we've talked about the three-legged stool over a long period of time, and it was really about supply. It was about the administration and logistics, and certainly about demand. And we have now administered more than 6.7 million doses of COVID vaccine throughout the state of Washington. And I just really, again, underscore how critical it is, the work that we do here. Next slide. Our 4 state-led mass vaccination sites have been doing just an amazing work with our partners in the emergency management, the WA National Guard, and also all sorts of other partners in the private and public sector locally. In the 3 or 4 months that we have been open, they've given out nearly 300,000 doses of COVID-19 vaccine. And I just can't say how important it was to fill this gap at a time where we really didn't have a lot of the capacity that was built. But now the capacity is available throughout the state in the communities where we have these mass vaccination sites, and we are now doing our best to demobilize these sites and move towards pivoting into mobile outreach efforts. And increasingly, you're going to see efforts where it's not just about people coming to us in the public sector, but our efforts to go to people. And we are really working in that regard as well. We are going to be launching over the next week to 2 weeks a set of an initiative called Caravans, and it's going to be an initiative to really get mobile outreach into communities across the state of Washington. We're very excited about that, and we're going to be releasing some additional information about this so people can understand how entities and partners on the ground, how they can sign up for being able to get one of the caravans in their communities. And we are really working with our local health departments. This is not in opposition, this is in complement to the work that's happening within our local jurisdictions. And I want to thank our Department of Health team for really moving forward in this work as well. Next slide. And finally, I guess the other piece of this is that we've administered almost 86% of the more than 7.8 million doses that have been delivered to the state of Washington. Again, a testament to the efficiency of the work that we've been really engaged in, and Washington continues to focus on not just the numbers, but also the equity pieces, which our efforts in mobile outreach will continue to hone in on as we move forward. And I believe that's it, Frangie, unless there was one more. Oh yeah, one more, which was if you need to get help in getting a vaccine, this is the way to get it, 833 Vax Help. This line is available with language assistance, and we've extended hours. We want to make sure people are using this line, 833 Vax Help. We want to do everything we can to provide people information on where they can get vaccines. And so if we can close out the presentation here, I just wanted to really underscore the fact that vaccines continue to be our road to the future. We are starting to see some difference, as I've pointed out over the last few sessions, that vaccinations are protective, the benefits outweigh the risks, but we do not want to see a tale of two societies where we have the vaccinated who are largely protected and able to go about their business, knowing that they are not going to be infected by COVID-19. And then you have the unvaccinated who are also going to try to go about their work and their business and their life, but they're continue to be at risk for infection with COVID-19. That would be a terrible place to be, and I want to make sure that we do everything we can to get and encourage people to get vaccinated. So now I'll turn it to Dr. Lindquist as we talk about a number of things, but in particular around myocarditis and pericarditis cases that we've been seeing across the country. And we're also have similar investigation of potentially this happening within the state of Washington as well. We obviously want to underscore that further investigation is needed, whether there is true connection to COVID-19 vaccines or whether this is just related to having vaccines be out there in more people, and the vaccine experience. As that increases, we're going to certainly start to see and will be seeing additional things that will be happening, and they are not always related to COVID vaccine. So we're working very closely with our partners on the ground, local health partners or providers, and also with the CDC, the Centers for Disease Control and Prevention, to really do more in terms of exploring what's happening, investigating this further, and really making sure that we're underscoring the importance of continuation of vaccines, because we do believe that COVID is still far more dangerous and vaccine is absolutely the safer and effective choice. But we do want to make sure that we're giving serious consideration and exploration as well as investigation of the small number of situations that we have come across. So with that, let me turn it over to Dr. Lindquist, and then I'll be available at the end for more questions and answers. Scott?
Yeah, thanks. So I just want to set the background for everyone that we see myocarditis and pericarditis every year. We have a known background of this. It's not incredibly common, but we do have a background of this. And just to make sure we're all on the same page, myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the saran wrap lining of the heart, or the pericardium. So these are things that are usually caused by viral infections that we see at this time every year. We look at our numbers to see, are we seeing an increase above that baseline that we usually see every year? And we are not seeing that. However, we had several patients from Washington that were identified with myocarditis that had received the vaccine. So we were very aggressive in talking to the provider community, the public health community, to say, hey, look, if you've got any of these cases, we want to hear about these so we could go through the details and work out whether this is associated with the vaccine or not. And with that, we got quite a big response, and I'll let Dr. Don Reedy really talk about this. And Elizabeth, I don't see you. Oh, there you are. Talk about this, what it means for their institutions. But essentially, we got quite a big response, not unexpected. We know there is myocarditis and pericarditis that is happening in the background. And as you heard, 60% of all older kids and adults have received vaccine in Washington State. So it's not uncommon that many of these that have myocarditis or pericarditis from another cause would have had a vaccine or just received. Now, when we look at these numbers, we get a large number of people talking to us and saying, hey, I think I may have a case. At the point that we got more than a dozen, I called the CDC and invited them into Washington State and said, hey, can you come in, help us pull the medical records, review these cases, and really establish a case definition for myocarditis and pericarditis and a standardized tool for collecting the information. And let's go through all these cases. And they are in the process of sending a couple folks out from the CDC to help us do that. So we are very, very early in this investigation, and I don't have any certainty that this is cause and effect. At best, we can say we have expected number of myocarditis and pericarditis, and we're going to work through those details to see if they're related to the vaccine or not. And so, Dr. Dunreedy, anything you want to add to this?
Yeah, thank you, Scott. I think Dr. Mead was going to speak as well, but that is my understanding that we do see myocarditis, pericarditis in young individuals in particular. There's a lot of other viruses that circulate, not just COVID, that are associated with myocarditis and pericarditis. I also want to put in context the benefit of the vaccination compared to this potential association. We know that there is a real threat with COVID in children. Most people think that it's fairly asymptomatic in children, but we have, since last mid-May, when the CDC started tracking, we've had over 3,700 cases of severe illness called multi-system inflammatory syndrome in children, and 35 deaths, known deaths from that condition that are associated with COVID infection, not vaccination. So we know that COVID infection can be severe in children. And so these reports of potential association that have not been confirmed should not be a reason for people to not get their children vaccinated. This is really important, as Dr. Shah mentioned, that we need to get our community vaccinated, and our children in particular. We're very excited on May 13th when another group, eligibility group, opened up. These young adolescents want to be active again. They want to get out, and I'm sure Dr. Mead, who sees more children than I do, has heard this, that kids want to get back to school, want to get back to sports, and want to get to be able to see their family members that they haven't seen for a long time. And this is the way that we're going to be able to do it. I'm still strongly encouraging parents to get out there and get those kids those second doses that have had their first doses already. And if they haven't even gotten their first dose, to get out there and get that dose.
Dr. Mead, anything you want to add to this?
Yeah, good morning. I'll just reiterate some of the things that we've already gone through that I think the Washington chapter of the AAP feels are most important. So we're aware that DOH and the CDC and the Oregon Health Authority have reported this relatively small number of cases of myocarditis in people who have recently received their COVID vaccines. And as has been mentioned, that's an inflammation of the heart muscle. It's generally very mild. It's typically treated easily with ibuprofen or other anti-inflammatory medications. And this is something that, again, regularly occurs in the community and most often in adolescents and young adults. So we see this not infrequently in the pediatric world. It is associated with circulating viruses, as we've talked about, and viruses that kind of occur at baseline in our communities. And we know that COVID itself can also cause myocarditis as well. At this point, I think it's important to just say again, there's no clear causal relationship between the vaccines and myocarditis, but we are watching this very closely along with our partners at DOH and the CDC. And really, we're looking forward to more information so that we are able to determine whether there's a relationship there at all and then make ongoing recommendations. As has been mentioned, this is about the same rate of baseline myocarditis that we see in our community. So at this point, we're not seeing an increase in reports of myocarditis above what we typically see. And I think it's really important that what we do know is that the many layers of systems that we have in place to monitor vaccine safety and any potential side effects are really doing their job, which is exactly what they're designed to do, and sort of alert us whether there's even a potential for any possible adverse effect or side effect from vaccines. So we really would remind healthcare providers to be vigilant about reporting to bearers and any possible cases of myocarditis or other unexpected events during the period of time after people have received their vaccines. And then lastly, I'll just share that we also know that COVID-19 illness and its associated complications are a very real and very present threat to children and adolescents. So there have been more than 300 pediatric deaths in the US as of May 13th, and many more kids and teens who are really having serious illness or long-lasting complications from COVID. And we know that absolutely the best way we have to protect them at this point is through vaccination. So those vaccines really protect recipients from infection with enormous efficacy, and the overall safety of vaccines has been demonstrated through that careful evaluation. So at this point, we really encourage anybody who's not yet vaccinated or is deciding vaccine for themselves or for their adolescent to talk first with their primary healthcare provider. I think that's really the best place to start about any questions they have or information they need. We at WCAP are really carefully following all information gathered, and we have been doing that since adolescents first became eligible for the vaccine, and really are reassured by the overwhelming number of teens who have been safely protected so far. So we continue to support vaccination for all eligible adults and teenagers, and our greatest consideration really is for the health and safety of our patients in our community. So we'll continue to update our recommendations as we get any new information, and certainly we'll communicate that out to pediatricians and to families as well.
Yeah, thanks so much for that. I just wanted to summarize that we understand the concern for myocarditis and pericarditis. We have thrown a very broad net in Washington State. We are understanding that is probably going to overrepresent what's going on, but because so little is known about this, that is why, once again, Washington State on the cutting edge, really leading the nation in understanding what this potential could be. Having the CDC here, having some really good baseline information on these patients as we rule them out, and a reminder that we're not just getting cases or concern for suspect cases in adolescents. This is in all age groups at this point. That may change as we get information about them, but at this point, stay tuned. It's very early in the outbreak investigation. And with that, Francie, we'll turn it back to you.
Thank you, Dr. Lindquist. This brings us to the Q&A segment of today's briefing. We do have several media with questions today, so if we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question today comes from Ariel with the Spokesman.
Great, thank you so much. I'm curious how many cases of myocarditis or pericarditis following vaccination have been identified so far, and what timeline you expect on the CDC's investigation, and at what point, the CDC could pause vaccinations in kids, how far out that would be time-wise, but also what data would they need to see to come to that conclusion?
Yeah, Ariel, this is Scott Lindquist. We have no confirmed cases at this point. We have asked for a lot of suspect cases, and that will change. I mean, for example, one of the suspects was reported to us when we started looking at the clinical data. We find that they had myocarditis, but then they got vaccinated 2 days after they were actually seen by their physician. So while that was a suspect case, and we certainly give it full attention, that will not be a case. And so we need to do that for as many of these concerning cases of myocarditis that we see. And that is going to take some time, probably at least a couple days before CDC is on the ground here. And I'm hoping to get through these cases very quickly. We are going to use some of our public health staff from Public Health Seattle King County and also from DOH to really go through these cases quickly. What the CDC has offered us is the expertise of a pediatric cardiologist and adult cardiology. And as we go through each of these cases and rule them in or out, then I can give you a much clearer number of how many cases Washington has. We have no confirmed at this point.
All right, our next question comes from Steve with Como.
Hi, thanks very much for taking my question. My questions concern vaccination rates for COVID-19. And I'm wondering if you could talk about the level of concern, what level of concern do you have about the disparities in vaccinations from county to county? And Dr. Shah, I know you talked about more details with the Caravan program coming out in the next week or two, but can any of you talk more specifically about the state's efforts to shift to a more mobilized based program and the help that will be coming to counties to try to even out some of those vaccination rates across the state?
Hey, Steve, can you hear me okay?
Yes.
Yeah, I'm sorry. I've been having since Dr. Lindquist started speaking. I won't blame it on him, but I've been having trouble with my audio and video. So I will do my best to try to through the technology snafus here. But you know, I think what the real work that is about getting to the last mile is not just about the work to date. It's really about what is the work ahead. And, you know, I think one of the things that we've had conversations with both internally as well as with Governor Inslee and his team, and then certainly with our local health partners and a whole segment of others like private sector, is that it is going to require different strategies as we move forward. And so we know that the strategies that we have used to date have gotten us to where we are, which has been quite successful, and we're proud of the efforts that all of Washington have been able to achieve thus far, as the statistics have shown, and we've been one of the leaders across the country. However, we've got to not rely only on those things. We have to really be thinking about the road ahead. And that means that mobile outreach is so critical, the pivoting to being able to get into, for example, more rural communities, smaller jurisdictions, working with our local public health jurisdictions that they're doing, supporting that work. And then certainly the work in BIPOC communities and making sure that we really are true to the notion that no matter who you are, where you live, you've got access to not just vaccines, but you have the ability to get those vaccines, and you're not in any way stopping or preventing yourself from getting those vaccines, that we're making every impediment that we can think of not be an impediment for you. So I think there are a lot of things that are really in the mix right now. And this is really a capability, the Caravans capability that I refer to is a capability that we at DOH have not had previously, but it's acknowledging the fact that we have to really be markedly more robust with the work that we do, not just for COVID-19, but well beyond. So Steve, I think you're hitting the nail on the head, which is that the same strategies that we've used for getting us to where we are today have been successful, but we can't rely on those alone. We have to pivot to be able to add and incorporate additional strategies. And those strategies include really making sure that we remove every impediment and also help people understand and recognize the absolute critical importance of vaccines. And that's why safety and effectiveness are so critical to this, because we do want to make sure that this is not, again, as I said, a tale of two societies where we have, people who are vaccinated and protected going about their business, and those who are not vaccinated, not protected, and unfortunately getting sick. And that would be a terrible place to be, especially when we see what's happening across the globe, where there are so many places around the world where people would really want to get vaccinated. And here we have vaccines that are free, they're available, they're right down the street from you, and people are not availing themselves of that. And we want to make sure we do everything we can to change that narrative.
All right.
And Steve, I'll just jump in quickly and add, because you asked about the variability, there is a wide range. If you look at the metric that we reported out today, so the percent of the population 16 and older that has received at least one dose, statewide, that is just over 60%, and the range among counties is 28 to 77%. So, you know, we do have to focus where the rates are lower as we approach June 30th and reopening with all of these strategies, working hand in hand with our local partners in public health and community-based organizations so that we don't see that tale of two societies that Dr. Shah mentioned.
All right, our next question comes from Nicole with Cairo Radio.
Good morning. Thank you for taking my question. Now that we're reaching 60% of people 16 and above who have gotten at least one dose, at what point in the vaccination progress, assuming that things still continue to go well and people still continue to get vaccinated, at what point would we see COVID-19 potentially kind of disappear? Or is this something that we're looking at being in our lives from now on, like the seasonal flu, and something that we'll just have to kind of deal with when it comes back every year?
Well, thank you for that. Nicole, can you guys hear me? Again, I had to switch again a device, so apologize. Can you hear me okay?
I can hear you.
Yeah, you know, I think there's really a lot of unknowns there. And I wish that we had a good answer for, you know, for that question. First of all, we're absolutely laser focused on vaccinating as many people as and as equitably as possible throughout the state of Washington. So that's, I think, the first and key point. But secondly, is that we are starting to see the benefits of this. You know, we talked about the last two sessions where those who are 45 to 64 and those who are 65 and above, the reduction in the risk for hospitalizations if you're vaccinated versus not being vaccinated. So we do recognize that there is a lot that we have made progress on, but a lot that we still do not know. We do not know what a percentage will truly be that's going to allow us to once and for all, you know, get through this pandemic and push COVID completely into the ground and be done with it and put our, you know, victory flag and we say we beat this virus. The real challenge we have is that again, a lot of this depends on people in our communities who we hope will do the right thing and get vaccinated, will do everything they can to help someone else get vaccinated. But the truth is, if that does not happen, and this is not just a Washington phenomenon, but across the country or even across the globe, unfortunately, we're going to be with COVID-19 for a long time coming. Now, the question is, how severe will it be? Or will it just be that we'll have clusters and outbreaks every so often in certain settings that will be something that we will have to be dealing with? The reality is that there's a lot that we still don't know. Scott or Lacy or Michele, did you guys want to add anything to that?
Yeah.
Any comments?
Yeah, you know, the only thing I'll add is this comparison to flu is interesting, but COVID does not act like flu in any way, shape, or form. Flu tends to be seasonal every year, and COVID has been with us for over a year. So it's not acting like a seasonal respiratory virus. And I think what's the most interesting thing about this last year is we saw no appreciable flu season with the masking and the social distancing that we used for COVID. It absolutely wiped out flu. We didn't see the outbreaks. We didn't see the death. We didn't see the nursing home involvement like we had. So the real question in my mind is, what role does social distancing and mask wearing during the respiratory virus season mean going forward for COVID and other respiratory viruses? Because obviously very effective.
All right, our next question comes from Joey with the Everett Herald.
Hi, thanks for taking the question. I'm kind of switching gears back to masks. In King County, obviously, Dr. Jeff Duchin has advised that, strongly advised folks continue to wear them indoors. In Snohomish County, Dr. Chris Bitters said it's really up to folks at this point. Some people who are fully vaccinated still feel, uncomfortable being in a public setting like a grocery store without a mask on. Can you speak to how folks should be weighing the risk as cases continue to drop, at least in Snohomish County? And then, what do you see as the future of masks? I mean, is it like every winter we, put one on when we go into a grocery store, or do you think we'll be getting rid of them for good after folks get vaccinated?
Well, first of all, thanks for the question. I would say that, we absolutely recognize, and when we put our statewide guidance out and the stipulations that we were putting in place, we absolutely recognize the fact that local health jurisdictions or even business entities, and we want to thank our partners at L&I for issuing additional clarification and updated guidance this past Friday. That we do recognize that people have to, as we said last week, respect the rules of the room, know what's happening in your local jurisdiction, know what's happening in the business or the establishment that you're frequenting. And we want people to be able to do that, know that, and be able to follow that and be civil about it. And that's, I think, one of the biggest challenges we've had throughout this pandemic is that we've lost as Americans civility in the process. And so respect the rules of the room that you're in, know those rules, and really honor those rules. And so, what happened in King County with the directive that was placed by Dr. Duchin and Public Health King County is absolutely aligned with that. Is what the state has been saying, is that we have a statewide, here's what we are doing, and we're absolutely going to support local health officers and or businesses or entities that want to continue to have mask requirements in place or directives or recommendations. We're going to support that. The truth is that masks have been very effective. They were for a long time our only tool, but the tool that we now have that helps augment the work of masks is the ability to vaccinate. It doesn't mean that masks have no utility. They're no longer needed. I think I mentioned last week that I've got 3 kids who are under the age of 12, and every time they see mom and dad, who are both healthcare providers and champions of wearing masks, if we're getting out of the car and we do not have our masks on, our kids are going to, one, make sure that we get our masks on. But number 2 is that our 4-year-old especially will not wear his mask if he doesn't see mom and dad wearing a mask as well. So I think parents in particular have a role in championing and modeling this kind of behavior and the public health or the prevention behavior. The other piece of this is really around those entities that, at the end of the day, those people who may feel uncomfortable taking a mask down. Remember, there has also been a behavioral change over the last several months. Many of us feel comfortable wearing a mask, and maybe if we're in a crowded situation, it's not required, but we're vaccinated, so we decide that we don't need to wear the mask, but we feel more comfortable wearing it. And certainly if somebody is unvaccinated, we absolutely are still with the requirements of wearing the mask. So I do think this is really very much about people knowing their own risk and also recognizing what's happening in the situation that they're in, whether it's the business or whether it's the actual jurisdiction itself. Masks are not, we had said this months ago, once we get past vaccinations, masks will not just completely go away. There are going to be certain settings. We know that there are people that are immunocompromised. There are people who their physician might decide or healthcare provider might decide that it's best for them to keep wearing masks for a while. We do not want to shame people if they decide they feel more comfortable wearing a mask. But really, it's more about if you're vaccinated, you're protected, and in most settings, you do not have to wear a mask unless someone is asking you to. And if you're unvaccinated, you are not protected, and you've got to wear a mask, otherwise you're at risk for COVID-19. I hope that very detailed, comprehensive message really answers your question.
Yeah, thanks so much.
All right, our next question comes from Christine. Christine with the Seattle Times. One moment. Go ahead, Christine.
I'm sorry, I don't actually have a question. Thank you.
All right, thank you. Our next question comes from Chris Daniels with King 5.
Good morning. I think we're having fun with Zoom this morning. So here's my question, and I guess it's for the room. With all the talk this morning about demobilizing mass vaccination sites and caravans, I have a question that really would have seemed strange even a few months ago, but given the state's supply and our connection to British Columbia through trade and travel, I'm curious whether the state's given any thought to border clinics which could serve U.S. and Canadian citizens, similar to what has been done in Montana and North Dakota.
Thanks, Chris, and you're absolutely right. Zoom fun is really incredible this morning. So I'm feeling it, and I'm absolutely sensing it. I'm seeing lights change in the process. As you know, I had a discussion with my counterpart in British Columbia just a couple of weeks ago, about 10 days ago, and it was very much about what's happening there. Unfortunately, things from a vaccination standpoint, from a supply standpoint, we did not get a formal request for making any vaccines available. But we have been in any situation where we do have, for example, Canadian truckers, that is the one example that comes to mind, coming across the border, that we're not shying away from vaccinating. I mean, we do think there's a common purpose here. But I do think that we have given consideration for putting some proximity of efforts in closer to the border, and really it's the local health departments that are doing some of those things more so than even Department of Health. We're supportive of those efforts, but we obviously continue to be focused on what we're trying to do here in the state of Washington. Lacy, did you want to add something? Because I think you had also been working on this, you or Michele have been working on this issue, so it might be helpful to give Chris an additional pieces of information about this.
Yeah, briefly, we have given our providers flexibility to vaccinate people from Canada if they present in their clinics, or that's, a traditional clinic or a drive-through pop-up mobile clinic. I just want to reiterate the point. COVID is a threat to us in Washington State as long as it exists in the world. So, our goals really focus on protecting our population here in Washington State. But until we have good protection across the country and across the globe, we will be dealing with this pandemic. And so, we are focused on vaccinating as many Washingtonians as quickly as possible. And then we're going to do what we can to support the rest of our country and push to get the rest of the world protected as well.
All right, thank you. Well, we've made it through. Oh, go ahead.
Sorry, it's my background going crazy.
Apologies. Well, we've made it through our questions for today, but we would like to revisit Steve from Cobo's question, Dr. Shah, if you have a few minutes, so that they can grab some video, and it might also be a great time to hear from our guests as well.
Yeah, actually, I'm still working on a little bit on my Zoom piece, which hopefully in just a couple more minutes, I'll have it all fixed up before, by the time the briefing is done, which is perfect. But why don't we turn it to our guests if they wanted to add something? I particularly wanted to really ask about the pediatric experience and how our partners are seeing the importance of not just 12 to 15-year-olds that have been eligible for vaccines, but also the road ahead when it comes to other ages, obviously markedly younger ages of children being vaccinated. If maybe either of the two of you could just touch on that and your thoughts about what the road ahead looks like for pediatric vaccinations and especially as we think about as we get into the school season in the fall.
I'm happy to speak to that a little bit. I think that we were incredibly excited when 16 and 17-year-olds and then 12 to 15-year-olds became eligible for the vaccine. We know that not only is it the best way really to protect them from COVID and all of the associated complications and really long-term complications that we can see in pediatric patients, but also it allows them to get back to all of the recreational and educational and social things that they have been missing out on that has so deeply affected their development over this time. So I think that we're very much looking forward to more information and more data about safety in those younger age groups. We know that this is a population that, although they are not typically seriously affected by COVID, which is wonderful and unusual in pediatrics for a virus to be less severe in children, that they certainly contract COVID, they can spread COVID. And I think as we think about getting back to school, especially in the fall, it is critically important that we really think about how we can get younger kids vaccinated, because we know that getting back to school and sports and all the other things that are so important for their development and really their overall health is just crucial.
Yeah, I'd like to just add on to that, we did just hear in the last few days that the other mRNA vaccine is probably going to be pursuing FDA emergency use authorization for the 12 to 17 age group, and that's the Moderna vaccine. And then there's probably going to be some movement late summer, early fall for younger children to be vaccinated as well. And so that's really exciting as we move towards getting the majority of our population vaccinated, and including our children as well. My son got vaccinated recently, who just turned 12, and he was very excited, and he's getting his second dose in the next couple of weeks. With regards to making sure that we reach this population, I think it's going to be really important, particularly when we're looking at it with an equity lens for parents who work, and we want to have vaccine programs that are going to be really easy for families to navigate so that these children can get vaccinated. There's already a number of programs in schools, which is excellent, before the schools let out, that some of these middle schools are already offering it on site to children that they can go and get that there. And I think those continued efforts will be really important to reach the younger age children as well.
That's great. Thank you so much. I think that pediatric perspective is so critical to really the road ahead, and we want to make sure that there's been a lot of confusion because people have been sensing, oh well, kids don't get sick, so we don't have to worry about them, or kids are resilient, so we don't have to worry about them. And then the second piece of that is certainly just the fact that vaccines have been added to the mix for younger populations later than adults. And so I think there's also been some confusion about what that all means. And so thank you for those two perspectives. Really appreciate it.
All right, Dr. Shah, we can turn it over to you for closing remarks. If you would like to offer any final comments in particular about vaccination rates between counties and our 70% goal by the end of next month, that will help our TV reporters. Thank you so much.
Great. Well, I just want to say thank you, first of all, to everybody for all the efforts that people have made across the state for really recognizing the critical importance of vaccines and the vaccination process. We knew we were going to get there. It was just going to take time, and patiently and yet with an incredible amount of hard work, all the teams across the state, at the state level, the local level, our private sector, hospital, healthcare, have really done an incredible job. But our job is not done. We certainly have a lot of work still to do. We're trying to get to our goal of 70% of those 16 years of age and above to get vaccinated. And we are not there. We're just above 60%, which means we have work to do. And we also know that the work to date has been successful, yet this road ahead of us, the last mile, if you will, is incredibly difficult, and it's also going to require a change and augmentation of our efforts. What we have done previously and what we are doing now means that we have to do everything we can to work together in order to be able to vaccinate. And our key message is don't hesitate, vaccinate. We know that there are certain communities across the state that are not able to share in what we're seeing in other parts of the state. And we want to do everything we can to really make sure that no matter where you are, where you live, ultimately vaccines are available to you. And we see vaccination rates that are not just differences in vaccination rates across counties and communities, but we start to see those counties and communities all come together so we can ultimately vaccinate as many people across the state of Washington so we can finally put this pandemic to an end. So with that, thank you so much. And I really look forward to the continued work ahead. As the Secretary of Health for the state of Washington, I've made it very clear that I'm the Secretary of Health for the entirety of the state of Washington. And that means that we have to do everything we can to be able to work together to vaccinate and ultimately do everything we can to improve the health and well-being of all Washingtonians. And so thank you for that. And let me just close by saying thank you to everybody that joined us this morning, our guests, as well as our team at DOH. Apologies again for the technical snafus that I had with Zoom this morning, but I'm really glad that we were able to talk through a lot of very important issues and look forward to a continuation of this discussion over the next several weeks. Frangie, I'll turn it back to you to close.
Thank you, Dr. Shah. This concludes today's media availability. I'd like to thank our panelists for their time today and for TVW for hosting today's live stream and archives of past briefings. Thank you all and take care.